All right, today we're talking about a drug that's, well, it's right on the knife's edge of emergency medicine. It's called Alteplase, and it's known as the high-stakes clot buster for a very, very good reason.
So let me just ask you this. What if a drug could just stop a stroke in its tracks? I mean, picture it. Someone you love is having a stroke. A clot is cutting off blood to their brain, and then a doctor gives them something that literally dissolves that clot. That's the incredible promise here.
But, and this is a huge but, using it is one of the biggest gambles in all of medicine. Seriously, the line between saving a life and causing something absolutely catastrophic is razor thin. So let's get into it. How does this thing work, and what makes it so risky?
Okay, so first things first. What are we even up against here? The enemy is a blood clot. You can think of it like this sticky, tangled web made of a protein called fibrin. Now, when that web forms where it shouldn't, say in an artery going to your brain or your heart, it's like a dam. It blocks off blood flow, cuts off oxygen, and the tissue just starts to die.
And that's where our, let's call it, hero comes in. Or maybe anti-hero is a better word. This is Alteplase. It's a super powerful drug designed to do one thing: bust clots. What's really fascinating is that it's basically a man-made version of something our own bodies produce naturally, called TPA.
So yeah, just to be super clear, Alteplase, you'll also hear it called RTPA, is purely an emergency drug. Its whole purpose, its one and only job, is to get in there and obliterate dangerous blood clots. And it has to do it fast.
Okay, but wait a minute. How does it manage that without, dissolving every single clot in your body, even the good ones that stop you from bleeding? Well, the answer is pretty brilliant, actually. It's all about its targeted mechanism.
See, this is what makes it such a game changer. The older drugs, they were like a shotgun blast. They just went to work everywhere in your bloodstream, which, as you can imagine, jacked up the bleeding risk all over. But Alteplase, it's more like a guided missile. It's fibrin-specific, which means it kind of just floats around, mostly inactive, until it locks onto its target, that fibrin web in the dangerous clot.
And here's how that missile hits its target. It's this beautiful little chain reaction. First, Alteplase finds the clot and binds right to it. Step 2, it finds this other thing that's already trapped inside the clot, called plasminogen. It flips a switch, activating it into something called plasmin. And then, step 3, this is the cool part. Plasmin acts like a pair of molecular scissors. It just starts snipping apart that fibrin web, dissolving the clot from the inside out. And finally, boom, the clot's gone, and blood flow is restored.
So you've got this incredibly powerful tool. Where do doctors actually use it? Well, they bring it out in situations where, and I mean this literally, every single second is critical.
And this pretty much sums up the big 3 emergencies. For a stroke, an ischemic one, that's the kind caused by a clot, the goal is to save brain tissue, and you have this crazy tight window, just 4.5 hours. For a big heart attack, you're trying to get blood flowing back to the heart muscle, and you've got a bit longer, maybe 12 hours. And for a pulmonary embolism, a massive clot in the lungs, it's really a last resort for patients who are in shock.
And when it comes to stroke, there's this mantra you hear everywhere in the ER: time is brain. And it's not just a saying. For every minute that goes by, millions of brain cells are dying. So the faster you can get Alteplase into that person, the better their chance of walking away without permanent damage.
And giving this drug isn't just a simple injection. No, it's done with incredible precision. For a stroke patient, they'll give a small burst, just 10% of the dose, really fast, over 1 minute. Then the other 90% is slowly and carefully dripped in over the next hour, all while the team is watching the patient like a hawk.
Okay, so now we have to talk about the flip side, the dark side really, because a drug that's this good at dissolving clots can also be incredibly dangerous. This is why, before they even think about giving it, doctors have to go through a super strict safety checklist. And some things are just absolute deal breakers. These are the hard stops. If a patient is actively bleeding somewhere, or they've had a brain hemorrhage before, or major surgery recently, Alteplase is completely off the table. The risk is just way, way too high. End of story.
But then you get into the gray areas. These are what we call relative contraindications. Maybe the patient is on blood thinners or they're pregnant. In these cases, it's not a hard no. It's a really tough judgment call. The doctors have to weigh the potential to save a life against the very real risk of causing a devastating bleed.
And that right there, that's the central conflict of this drug. It truly is the ultimate double-edged sword. And the other edge of that sword? It's terrifyingly sharp.
I want you to just let this quote sink in for a second. The most predominant and dangerous side effect is bleeding. And we're not talking about a little oozing from where the IV is. We are talking about major, catastrophic, life-ending bleeding.
And here's the number. This is the statistic that keeps doctors awake at night. For the very stroke patients you're desperately trying to save, there is a 2 to 6% chance that this drug will cause a massive bleed inside their brain. Think about that trade-off. It's a small but potentially fatal risk versus the almost certain outcome of severe, lifelong disability if you do nothing.
So what happens if that worst-case scenario unfolds? Well, it's all hands on deck. The team immediately stops the infusion and starts pumping the patient full of clotting factors, trying to reverse what the drug did. But here's the thing. There's no simple off switch. It's a frantic scramble to plug a leak that the medicine, the very thing you used to help, created in the first place.
So, when you put it all together, what is Alteplase? It's a cornerstone of modern emergency medicine, no question. It's a miracle drug, really. It can pull people back from the brink. But all that power comes with this huge, ever-present risk. And it all comes down to this one incredibly heavy question. It's the question a doctor has to answer at 3 a.m. with a clock ticking down and a life hanging in the balance. How do you balance saving a life with the risk of ending it? That's the profound, awesome responsibility that comes with using a drug like Alteplase.